Hi, so my name's Sarah Ray, and I'm really keen to share some exciting news with you about a new mental health project that launched recently. I am someone who has lived experience of mental health struggles and challenges, which has resulted in me accessing secondary mental health care services, but also I had a long inpatient admission for 8 months some years ago. It was, yes, I mean, it was very distressing being on a ward for that length of time. But the most traumatizing part of it for me was the discharge, which I found really difficult to cope with. And when I got out of hospital and I started talking to friends, as you do, who are also mental health services, I found that actually my experience, well, it wasn't unusual. Lots of people had difficulties with the discharge process and felt very unsupported. That was the sort of more personal side of it. But then Mind conducted a leaving hospital survey in 2017, and the results were shocking. In terms of the findings, they resonated with my experiences, and I felt I absolutely had to do something. It spurred me on. And I also knew from my experience with other research projects that research is one of the best ways to understand when things are not working well. So I started recruiting a research team. Wasn't easy because I'm not an academic, but eventually, after 3.5 years, a very hard graft, we heard the fantastic news that the NIHR, National Institute for Health Research, had awarded the project £1 million in funding. It blew me away. It was a surreal moment, and yeah, I think my heart really missed a beat that day. So what is MINDS? MINDS is a research study that aims to improve the experience for people who are transitioning from an inpatient ward to the community. And actually not just their experience, but outcomes for people. So perhaps, they are less likely to go back into hospital. I'm co-leading the project with consultant psychiatrist John Wilson from NSFT, Norfolk and Suffolk Foundation Trust. And I suppose for me, I have been absolutely determined from the outset that this project will be a co-led and a co-produced project. I want the voice of lived experience to be not only woven into the project, but valued equally to professional expertise. It was absolutely the highlight of my week last week was meeting the Lived Experience Advisory Group. We invited people from the different trusts that we're working with to collaborate with us, and just seeing them exchanging a few words and starting to think about how we're going to collaborate was a really amazing experience. They're a great group, and I'm so looking forward to our regular meetings. So really, that's it. Minds has got off to a flying start, and it's going to be an interesting journey actually, because the project runs for 3 years. So that's exciting, and I'm going to be posting about the progress that we're making fairly regularly. So do look out for updates.